Hello, everybody. We're here for another MS Neuro TV program, and this is provided to you by MS Views and News. And my name, for those that do not know, I don't know why you don't know, but my name is Stuart Schlossman, and I'm president and founder of MS Views and News. And tonight's program, we are doing MS Neuro TV, all right? And our guest tonight is Courtney Aldrich, and Courtney is from the Massachusetts area. I was always thinking New Hampshire, but she's from Massachusetts. And Courtney is a licensed clinical social worker. And yes, the LICSW is different than most of us know for a licensed clinical social worker, because I think most of the time we just use LCSW. Maybe she'd explain that also along the way. But Courtney tonight is going to speak about, well, what you see on the screen, okay? So I can't wait to hear what she has to say. So I'm going to give this to Courtney and let her take it away, okay?
Thank you, Stuart. Perfect timing, I was going to say. And the I is for independent. I don't know. For some reason in Massachusetts, they feel like they need to make it clear that we're independently licensed. So nice to meet you. I'm so excited to be here, share a lot about trauma, mental health. I'm a social worker, so I've always been in the mental health world. But when I was diagnosed with MS and learning about resources, I just felt like TCTSY or trauma sensitive yoga is definitely something I am passionate about and I think could be really useful to learn about. Treatment in lots of different ways, not just talk therapy. So first slide. Great. Thank you so much. So this is a little bit about what our time will look like. So I really want you to be comfortable. If you're present, if you're watching this as a recording, whatever, be comfortable. We're going to talk about some heavy things, right? Trauma, mental health. I always tell everybody, I'm a therapist, but I think everybody has mental health. As you will talk about today, everybody has a nervous system. We all know that as people with MS. And how mental health and physical health are connected and how we can treat them is really interesting. So I hope that you find this talk valuable. So an intro, some research about trauma, and we'll kind of go from there. So Courtney, yes, LICSW, I'm a clinical social worker. I run Fenthera, which is a mental health practice in Massachusetts where I do a lot of groups because, like I said, everybody has mental health. And I think one way to be creative as a therapist is to bring people together. So doing art, doing yoga, non-traditional ways to access care, I am a huge advocate for. So I always introduce myself as a social worker and expressive art therapist, but I also thought it'd be really important to include I have MS. I was diagnosed in 2021. I also have my PTSD diagnosis there because sometimes I joke and I'll put Courtney Aldrich, I'll just put my diagnoses after my name. But we'll have my credentials for now. But I do think it's important because as someone with lived experience, I come to you not only as a provider and a clinician that's sharing like a lot of really cool science-backed research, mental health treatment and techniques, but also my own lived experience, both dealing with PTSD symptoms and with MS, and how trauma-sensitive yoga is just such a cool way to treat both, I think, for me. And hopefully can be something that you find useful. So to begin, trauma is subjective. That is the most important thing I want to start with today. So as a social worker, I worked in the school system, I worked on the hospital unit, and it does matter what happened to you, but trauma really is kind of based on the person. So trauma is inherently, as Bessel van der Kolk says here, the essence of trauma is something that is overwhelming, unbelievable, and unbearable. So it's just, I always say it's something that your brain will just refuse to process. So this can be experienced as a lack of safety, both your physical safety, but also your psychological safety. I think that is a huge one that we don't always give a lot of attention to. A lot of people say, I was physically safe growing up, but your social emotional safety is huge. So trauma can be experienced as a car accident, it can be experienced as a natural disaster, but it also can be childhood abuse, childhood neglect, as we'll kind of see later in this presentation, bullying, lots of different things can happen that can cause trauma. And trauma shows up in the body physically. It also shows up, of course, psychologically. symptoms such as hypervigilance, flashbacks, but physically it'll show up as a lot of tension, a lot of stress in the body, anxiety symptoms, shallow breathing. So all of this is really good information as we kind of learn about trauma-sensitive yoga, mindfulness, because mindfulness and trauma-sensitive yoga is all about being in the present, being aware of what is happening in any given moment and allowing it to be there. So this is a little bit about trauma. So most researchers or clinicians, when they're talking about trauma, they will reference this study. So this is the ACEs study. So ACEs, Adverse Childhood Experiences. And this study was conducted between 1995 and 1997. And during this study, 17,000 adults were surveyed. And of those 17,000 adults, more than half of them, as you'll see written right there, 64% had at least one, they reported at least one ACE, so one adverse childhood experience. So I think it's really important to kind of let that sink in, because a lot of times when I go to lectures and talks about ACEs, a lot of us talk about preventative healthcare, preventative mental health care. We talk about ACEs, but 64% having one is huge. It is very huge. And so you'll see on this chart by the CDC, kind of some different examples. These are the 10 that they surveyed people of. So is there abuse? So abuse can be physical abuse, it can be emotional abuse, verbal abuse, sexual abuse. Is there neglect that took place in your home? This was all part of the survey. So physical neglect could be a lack of food, a lack of shelter, not being able to get your basic needs met, and also emotional neglect. This is a big one I see all the time, I think is so present and not one that we give a lot of attention to, but not being able to be seen as an individual, as someone else, maybe because, as you'll see in the other part, maybe there's a family member with a mental illness, maybe there's a family member that's incarcerated, maybe there's separation, divorce, substance use in the family, domestic violence. So all of these things contribute to what researchers found to be, more adverse child experiences leading to disease, disability, social, emotional, cognitive impairment later in life. So I think it's really important to kind of just pause here, notice these things, notice letting it kind of sink in. And also, the second statistic on this slide, that 17.3% of people, so 1 in 6 reported 4 or more. So 4 or more. And a lot of times I'll use this as a tool as a therapist. I know a lot of trauma therapists will use this as a tool to kind of assess what happened to you. Like, what is coming up? What is contributing maybe to mental health symptoms? And what is going to be most helpful in your treatment? If you're going to therapy, if you're going to yoga, whatever you're doing, what's going to be the most beneficial for you to be able to enjoy your life and take care of your physical health and, of course, your mental health. So yeah, next slide. Thank you. So a little bit more about the research of ACEs. So again, we saw on the last slide, the chart, abuse, neglect, all of the incarceration, substance use, a caregiver with a mental health illness, those kinds of things are considered adverse childhood experiences. And the more that a person had, they found in this study, that it was more likely that this person would have difficulty with education, maybe difficulty with employment, maybe substance use, mental health conditions later in life, and of course, possibly chronic illness and mortality earlier than expected. So chronic illnesses that this study kind of looked at was measuring ACEs versus ACEs and likelihood to develop diabetes, hypertension, respiratory disease, liver disease, heart disease, obesity, lots of different things. So research is really cool that way. We have to prove things before we can say that they took place. So just like in any study, we have to make sure that there's a lot of good science behind it. But I think just objectively, it's really great that there's a lot more research happening because of this study and because of other, I think, initiatives on trauma and mental health that really want to be curious about how adverse childhood experiences, trauma, impacts your body impacts your health, impacts your immune system. If there's cortisol and there's stress hormones being pumped into your body and your nervous system is in fight or flight mode constantly, I think for most of us, we can think pretty intuitively, yeah, of course there's going to be challenges later in life. So really cool to see different studies having a lot of this research coming in. So two of them that I want to point out because I think it's relevant to us, if you don't mind just going back to the last slide really quick. That's not possible. Okay, great, thank you. So 2021, a study of veterans in the US. So they found that veterans with PTSD versus veterans that didn't have PTSD, but both had MS. So veterans with PTSD had higher MS disease activity and more rapidly reached disability endpoints. And then in 2022, a Norwegian study of mothers found that sexual abuse and emotional abuse in childhood were both associated with an increased risk of developing MS. So those two data points I think are really useful. And a lot of people in the trauma community, a lot of mental health professionals, when we talk about trauma or PTSD, a lot of us will talk about complex trauma, meaning complex trauma is kind of this ongoing abuse, neglect, emotional abuse, emotional neglect. You know, families do the best that they can, but not being able to have access to mental health care, access to family supports, access to proper food, proper shelter, can really impact an individual later in life. So this piece, I guess before we kind of dive into all of these wonderful symptoms that I have listed here, I really want to talk about how emotions are experienced in the body. And a lot of times when I say this, I will ask people, maybe like a mindfulness tool, is to think about a place or an animal or someone in your life that brings you a lot of joy, that leads to a lot of relaxation, a place, a person, an animal. So kind of bringing to mind that place. Maybe it's the beach, maybe it's your dog, maybe you have your dog with you right now. So bringing to mind that, you know, I'm thinking about one of my favorite places, just being on the trail and like thinking about like, okay, wow, like noticing how your body can respond to that. A lot of therapists that practice mindfulness will do a lot of guided imagery. I think for those of you that are readers, that is an excellent way to practice mindfulness, because mindfulness is all about being present in the moment and noticing your sensory experiences. So emotions live in the body because our nervous system, right? Those of us with MS know this. We have a brain, we have a spinal cord, of course. We have 31 spinal nerves that go throughout the rest of our body, like an electrical grid. And emotions, I always say, are electrical chemical energy. So the energy between your neurons, the messages that are being sent, the hormones that are being released in your body when you feel an emotion, those physical symptoms are great evidence to what emotion am I feeling. Am I feeling fear? Am I feeling sadness? Am I feeling like anxiety? Those things will feel differently in your body than when you're thinking about your dog or when you're at the beach. So I like to kind of use that as a tool to begin to think about, all right, what is my experience? What is happening? And having this awareness about not only emotions in the body, but I think one of the most important emotions, fear or anxiety. So anxiety shows up in the brain. So I have brain listed here in the first column as cognition. So cognition is just kind of like a fancy word to say thoughts. Fancy, or just, I thought it was fancy when I started using that word, but cognition is thoughts. So anxiety or emotions show up, I guess anxiety, fear we're talking about. So anxiety shows up in your brain or in your thoughts, maybe as excessive worries, maybe as nightmares, maybe as flashbacks, maybe as intrusive thoughts, if it's PTSD, guilt, memory challenges. So that's the thinking part, the thoughts, how anxiety shows up in your brain. Anxiety also shows up physically in your body. So I have right here next to this little doodle person, fight, flight, freeze. And some of you might know, fight, flight, freeze is your nervous system's responding to a threat. So sometimes when your body's in a threat response your entire life or your entire childhood, your body kind of gets used to that. Your body gets used to being in fight, flight, freeze mode. So what are the indicators that your body is experiencing stress? Can be muscle tension, right? So your body is like getting ready to fight, right? We are mammals, we are animals. our body is responding to. Do I have to fight the bear? Do I have to run from the bear? Like my muscles need, like I need energy. My blood is all going to be pumped to my extremities to be able to run or to fight this imaginary bear that might be walking in at any time, right? So that's where this kind of comes from. And I think a lot of people go to therapy maybe to get rid of their anxiety. And I always tell people that anxiety really isn't something to get rid of because it's evolutionarily, it's going to be there. It's really about being mindful of it, being present with it, noticing it, and listening to the information it has for you. So it shows up as thoughts, it shows up in the body physically. So your chest might feel tight, you might have difficulty concentrating, you might feel tired, you might feel tense, right? Feeling on edge. And these are symptoms, some of them that come right from generalized anxiety disorder, PTSD. So how it shows up in the body, anxiety, and then how it shows up in your behavior, right? Avoidance, I always tell people one of the biggest symptoms of anxiety is irritability, because if your body isn't relaxed, your body's all tense, your thoughts are all full of worry, maybe about Thanksgiving or your plans or your work, whatever it is, you're going to be more irritable. Irritability is a great piece of evidence that, what am I feeling? I'm probably feeling some anxiety. So those are some of the behaviors of like manifestation of how anxiety or emotions kind of show up in the body to give us a little bit of evidence about what are they doing, what can we learn from them. And again, mindfulness, I love this piece, is all about being curious. So non-judgmental, curious, whatever is there, allowing it to be there, right? Noticing frustration, noticing anxiety, noticing thoughts. I always tell people it's really not useful to deny it or just to judge yourself or shame yourself for whatever's coming up, because it's there. So how can we welcome it? How can we be curious about it? And what are some different strategies that you can use to really honestly just enjoy your life more? That is the goal. So next slide, please. Great. Okay, so this piece, a little bit more about different types of therapies. I want to talk a little bit about what I'm going to call traditional therapies, and then I'll share a little bit more about mind-body treatment, where we will finally get into some TCTSY, or trauma-sensitive yoga. I know it is quite the long acronym, but once you get used to it, you kind of get used to it. So traditional therapy. So I think a lot of people, they're like, oh, okay, you're a therapist. I'm going to go sit on your couch. I'm going to talk to you. Sure. Yeah. Talk therapy. That's one way to engage. Like historically, that's a lot of traditional therapy, as I said. There's also medication. So I'm not a medication provider. That would be a psychiatrist or a nurse practitioner. So they could be overseeing your meds. Maybe your primary care physician, maybe your neurologist has something to say with that too. But those are the people, the physicians are doing the medication for anxiety and depression. But as a social worker, as a therapist, I do know a lot about medication, just because a lot of patients typically choose to have medication and therapy. Maybe they've tried medication before, maybe they've tried therapy before, and research really shows that both is most effective in mitigating symptoms of anxiety, depression, all kinds of different things like that. So medication, that is one. Another really, I think, kind of baseline therapy that I'd like to kind of talk about, which we'll get into how TCTSY was used in research when talking about cognitive therapies, is cognitive processing therapy. So CPT, or cognitive behavioral therapy, is really like the gold standard of therapy. A lot of therapists will focus on changing your thoughts, which can help to change your feelings, your emotions, and change your behaviors. So I always give the example with cognitive processing therapy. It's a little bit about being aware of, what am I thinking about? What evidence do I have that this thought is true? And then even like 1 to 10, like how much do I believe this to be true? So it's a little bit of like self-dialogue with yourself to kind of think through and logic your way through some of these things that a lot of therapists practice. And there's a whole kind of manual for cognitive processing therapy and cognitive behavioral therapy. Dialectical behavioral therapy, the third one on the traditional therapies list, is a type of therapy that, again, is kind of focused on thoughts, noticing emotions, allowing emotions to be there. That's a lot of what I practice, mindfulness with DBT. That kind of therapy was created specifically for people with suicidal behavior or self-harming behavior, but can be effective with a lot of people. And then exposure therapy. So exposure therapy, for example, if you're scared of being, like if you have a fear of being on a plane or speaking in public, you and your therapist would kind of slowly work up the anxiety hierarchy to kind of target the thing that's at the top of your anxiety hierarchy. So if it's going on a plane, maybe you'd watch a video of a plane and so on and so forth. So those are traditional therapies. And I think it's really important to kind of educate people about, like, that's what to expect when you go to therapy. Like, your therapist and you are going to come up with a goal if that's what you think is useful, and kind of go from there. Like, are we challenging thoughts? Are we working with emotions? Are we working with behaviors? What's the most useful? What's the most valuable for your life, right? Because the goal, again, is to be able to have a more joyful life. So traditional therapies. The second piece that I want to talk about before we get to TCTSY, or trauma-sensitive yoga, is mind-body treatment. So mind-body treatment could be something like yoga. It could be, like I have written here, progressive muscle relaxation. So progressive muscle relaxation is you're squeezing your muscles, so maybe your hands, and then you're releasing your hands. A lot of people say to start with your feet, so maybe squeezing your feet, squeezing the muscles of your feet, releasing, squeezing the muscles of your legs, and then releasing. And then so you kind of do a body scan all the way up your body, and then you kind of go from the face down. Sometimes that can be useful if you're having a hard time falling asleep. Again, maybe it's not. Everybody is different, but these are kind of just some examples that a lot of therapists use and you might see. So progressive muscle relaxation, EMDR. So EMDR is a type of therapy where you're processing trauma. You're using both sides of your body. You're kind of doing the back and forth with a wand, or with the therapist might use a pen or something to be able to process trauma memories. Deep breathing. So deep breathing is a part of yoga, but in TCTSY, how we practice TCTSY is not about teaching people how to breathe. It's encouraging people to notice their breath. I think for me, when I first started doing deep breathing, I would just hold my breath when somebody was trying to teach me a deep breathing exercise in graduate school. And I was like, now I'm just super conscious of my breath. So breathing is a very intimate process, right? It's literally you bringing life into your body and breathing it out. So deep breathing can be really helpful, but it can be really activating sometimes for people that have experienced trauma or already deal with a lot of anxiety. Sensomotor psychotherapy is another kind of body-based therapy that involves a lot of talk. And then I threw on here art, music, dance movement, mindfulness. I do a lot of art therapy in my practice, in my groups. That's all about your senses. That's all about kind of processing memories, being present in the moment, telling your story, and using a different method than just talking. Talking isn't always accessible, especially with trauma, because a lot of times when we experience trauma, the part of our brain that is in charge of kind of declarative language, the Broca's area, kind of goes offline. So we don't really have access to that part of our brain. And a lot of times trauma is stored as an implicit memory. So implicit memory meaning maybe you remember eating the peanut butter and jelly sandwich and what it tasted like, but you don't maybe remember putting the peanut butter on it, putting the jelly on it, putting it together, which would be your explicit memory, remembering like how to do something specifically, being conscious of it. Implicit memory is like you're just going to play a song on piano because you've always played it. You're just going to sing a song. So a lot of trauma work is with implicit memory, which is kind of what TCTSY is hoping to target, how your body is responding, how your body is being present. So to the next slide, we are finally at TCTSY, which I've said like 4 times, and my patients are always like, what? You were saying that word so fast. But trauma sensitive yoga comes, of course, from the trauma center. So if anyone has read The Body Keeps Score, that is Bessel van der Kolk's, that's his novel. And he is a psychiatrist and was very deeply involved in creating this type of yoga. And I think one really important thing I like to tell people is that there are lots of different ways to practice yoga. There's lots of different yoga for mindfulness, yoga for trauma, yoga for nervous system. I went to at the Y the other day. There's yoga for everything, but this particular type of yoga I practice, I am trained in because there is clinical trials and research to back up how it is effective in working with PTSD and working with complex trauma. So, what is trauma-centered, trauma-sensitive yoga? How is it different, right? So, of course, it's a movement. So we'll do a little bit of it in a couple of minutes, but it's a movement. So just like you'd go to any dance, any Zumba, any class, your facilitator, so if it's me, I'll be moving and I'll be kind of talking through like a guided meditation, what we're doing. So I'll be moving and I do a lot of my classes online. So people might have their camera on, camera off, kind of like a typical yoga class in that way. So physical movements. The second most important piece is that the focus is on the internal. So the focus is on you. The focus is not on the external. I think when I first started doing yoga, I came to TCTSY not as a yoga person. I came just as a clinical social worker, hoping to learn how to use this with my patients and use this in my own life. I think when a lot of people have gone to yoga classes, it's about there's kind of this focus on like creating a certain shape. Like, all right, we're going to be in tree pose, or we're going to be in downward dog, or we're going to be in tabletop. So creating, like kind of forcing your body to be in a specific shape that everybody else is doing. TCTSY is different because the focus is really on you and your experience. So for example, I might suggest like, okay, so maybe perhaps like moving your head back and forth. You can follow along with my movements, but it's pretty typical that in a TCTSY class, everybody will probably be doing something different. So it's really about noticing what's useful in your body, noticing sensations, maybe noticing something else. And that's all about the empowerment piece, which kind of leads to the third bullet about non-coercive language. So trauma-centered, trauma-sensitive yoga, the goal is safety. I think in any trauma work that you do, the goal is safety. So what does that mean, safety? Well, we talked about trauma. We talked about adverse childhood experiences today. Safety is about being physically safe, being emotionally safe, socially safe, psychologically safe, so that you have control, right? So in TCTSY, we're giving options, we're giving people control. So what that might look like, and you'll see in a little bit when I get into it, is I'll say things like, one option could be to lift and lower your arm. That's one option. If you'd like, maybe you'd choose to lift both of your arms. So always kind of inviting people, if that's what they're interested in doing, and not at all saying, all right, so now we're going to do this, and now you're going to do that, and now I need you to do this. That's about me. That's me telling you what we need to do. And it's not trauma informed. It's not allowing people to kind of participate at their own pace and notice maybe something different in their body than what I might be experiencing in my body, right? Because all of us, we live in different bodies. So our experiences will be different. And then, like I said, the fourth piece, empirically validated treatment. So there's a lot of, I think there's 30 published studies about trauma-sensitive yoga. And so I'll get into a couple of those on the next slide. But before we get to that, just this piece that Bessel van der Kolk said, that this quote that I'll read, yoga really makes it safe for you to experience yourself, even though your experience may not be all that great. Very important piece here, because I like to tell people mindfulness is great when you're eating a cheeseburger and your cheeseburger tastes awesome. Mindfulness is great when you're on the beach or you're with your dog and you're like, oh, so much mindfulness. I'm enjoying this moment. But mindfulness can also be being aware of like really uncomfortable feelings, thoughts, and in this case, physical sensations, right? So noticing sensations that aren't interesting to your body or don't feel comfortable. Yoga allows you to kind of experiment or explore what it's like to tap into some of that, right? So you get to choose how you participate is a big piece of it. So the last piece here about some research before we do a short practice today. So TCTSY has been around since 2002. You can visit I think it's traumasensitiveyoga.com. I have it on a later slide, but traumasensitiveyoga.com. You can read all of the research. They have it all there available at no charge. A couple studies that I wanted to point out. So 2009, they had a random clinical trial where yoga, they had yoga participants and then they had participants in a DBT group. If you remember, DBT is a pretty popular type of therapy that a lot of therapists practice. There's a lot of research behind DBT. So some people in the yoga group, some people in the DBT group, and they noticed that yoga participants had a greater reduction in PTSD symptoms and a more attunement to their body. So more awareness of their body and less PTSD symptoms. Huge. Absolutely huge. So less maybe re-experiencing emotional lability, like intense emotions, maybe less nightmares, maybe less cognitive distortions or negative thoughts about self. That's huge. So 2014, another study, again, they're all on their website, but these are just a few. 52% of participants in this study that were in the yoga group no longer met criteria for PTSD. So this was with women. This was all with women, I think, survivors of childhood abuse, I think particularly sexual abuse, in the 2014 study. And they compared this yoga group versus they were in a women's health education class. So which one is going to reduce PTSD symptoms more? In this case, it was yoga. The last one that I want to point out, they found that participants, these were women that experienced military sexual trauma. So these were female veterans. They experienced symptom relief with TCTSY a lot sooner than they did with cognitive processing therapy, which is one of those cognitive therapies, right? So that's all in your thoughts, all in your head. People are like, oh, I'm so in my head. Yeah, that's the thinking work. But TCTSY is all about being in the moment, being in your body, connecting with your body. So they found that there was symptom relief sooner from PTSD symptoms, and they found that people stuck with the study longer, that they stayed with it longer than they had a lower dropout rate than people that did the CPT piece. So very cool stuff. So all of that to say, a lot of thinking, a lot of cognitive work, right? A lot of thinking. All of that to say that there is a lot of research behind movement. I think for so many of us, movement can feel really challenging, especially, MS looks differently for a lot of people. I know for me, when I got diagnosed, I, at the same time, was doing trauma-sensitive yoga, and it just really helped me to be so attuned to my body. It just really helped me to kind of notice, all right, what is my body feeling? What do I need? How do I care for my body? How do I move my body in ways that are useful for me or interesting and valuable for me? Because MS can be challenging. MS can make it difficult to kind of notice that stuff as well. So it really complicates things. So yeah, I think we have a little bit of time. So I'm going to move my chair and I'm going to sit back here. Feel free to kind of follow along. If you're at home, you can pause, you can come back. But I really want to share a little bit of the practice so that you can kind of learn what I'm talking about, because it's kind of hard to understand unless you're doing it. So this is kind of what a TCTSY practice would look like. So hi, hello, welcome. And one way that I like to start TCTSY, some people will do this, is kind of to ground yourself in your space. So maybe grounding yourself in the space, one way to do that is to look around your room. So you might choose to maybe turn your head, maybe look behind you, look out in front of you. And one thing I like to do, which is a mindfulness practice, is to maybe notice one color and maybe notice like 2 or 3 things that are maybe the same color. So maybe a couple shades of blue. I'm noticing yellow in my space. So maybe noticing a color, maybe counting 1, 2, right? That's a cognition. So thinking, all right, grounding yourself in the space, noticing colors, finding 2 or 3. And then in your time, focusing on your physical body. So one way to notice your physical body is to notice where your body is connecting with the surface beneath you. So one way to do this is to move your torso side to side. That's one way to notice your body connecting perhaps with your chair, perhaps with the ground. You might notice the bottom of your feet or the backs of your legs, maybe a pressure shifting as you move side to side. Another option could be to move your torso forward and back. And the cool thing about this is there's really no right or wrong way to move. This practice, this space, is all about you noticing your body and maybe making choices about how to move based on what you're noticing. So maybe moving your torso side to side, using both sides of your body, uses both sides of your brain. So maybe moving side to side. And in your time, maybe making your way back to center. No rush getting there. And when you're at center, maybe inviting movement with your head and neck. So one way to move your head and neck is maybe to nod your chin, so nodding your head. So perhaps beginning by maybe lengthening your spine and maybe lifting your chin any amount, maybe looking up. That is one option. Another option could be to find the inverse, so maybe tucking your chin towards your chest, maybe looking down. And if you'd like, you might choose to move in between these two shapes. So maybe lifting, maybe lowering your chin. At any pace that's interesting to you. Maybe pausing, if that's more useful for you today. Another option could be to tilt your head to the side, maybe finding a way of moving your head and neck that is interesting to your body. So you might notice a sensation in your neck if you're tilting your head, or maybe you're choosing to move your head and neck in another way. You might notice a sensation in your neck, but this is just a suggestion based on what I'm noticing in my body. So maybe noticing a sensation, maybe not noticing anything at all. And whenever you're ready, maybe also letting that go, returning to center. Again, no rush. And a third way of moving, so maybe finding movement with your shoulders. So one option could be to lift and lower your shoulders. So you could lift one shoulder, maybe lift the other shoulder, maybe lift both of your shoulders at the same time. Again, here you might notice a sensation in your back or maybe in your shoulders, or you might not notice anything. Not noticing is also, interestingly, a form of noticing. Another option could be to place your hands on top of your shoulders, maybe noticing the texture of your clothing, and if you like, maybe drawing circles with your elbow. So maybe drawing circles with your elbows, maybe both of your elbows at the same time, maybe one at a time. Maybe letting this go in perhaps 3, maybe 2, and possibly 1. I gave this as an example earlier, but maybe lifting one of your arms overhead. So lifting your arm any amount. It's always your choice to decide how you move in your practice. So maybe bending your elbow, maybe lifting and lowering one arm. If you'd like, maybe switching to the opposite side, lifting your opposite arm, lifting and lowering your arm. You might lift both of your arms at the same time. And as you're moving, you might choose to notice your breath. So maybe noticing your breath, but again, you know how to breathe. I always tell people, I don't need to tell you how to breathe. So you might choose to instead focus on your movement, maybe disregarding your breath altogether. Or if you'd like, perhaps noticing your breath, maybe by pairing your breath with your movement. So maybe moving your arms out to the side, lifting as you breathe in one direction, and maybe lowering as you breathe out. So lifting your arms and breathing in, maybe lowering your arms and breathing out. Maybe one arm at a time. And again, there's really no right or wrong way to do this. So feel free to maybe move into another shape that's more interesting to you. Or if you'd like, feel free to follow along with my movement. So maybe 2 final movements before we close today. So maybe opening your hands, maybe opening and closing your hands into fists. That's another way to move your hands. So opening your hands, maybe spreading out through your fingers, and closing your hands. You might feel the pressure in your fists, opening and closing. Perhaps rotating your wrists if you'd like. So maybe moving one wrist at a time, or perhaps both. And if you're choosing to find movement in your hands or your wrists, you might notice a sensation, maybe a warmth in your body, sensation in your wrists. And in your time, like always, maybe letting that go. And for a final shape, maybe finding movement with your feet. So maybe noticing your feet, connecting with the ground. I always think it's like a bag of flour that you put on top of the counter. So kind of feeling that connection, and maybe lifting and lowering your heel. So maybe lifting your heel, maybe pressing into your toes. You could lift and lower both of your heels. Could lift your toes as well, but maybe lifting both of your heels, maybe one heel at a time, maybe both, maybe lifting your toes if you'd like I said. Moving at your pace. And if you're choosing to move your feet, you might notice the muscles of your legs engage as you're moving. And so perhaps in your time, maybe continuing to move, but to perhaps close the practice today, maybe finding a shape of rest. So maybe finding movement, maybe taking a pause for a couple of seconds. And if you'd like, maybe giving yourself some gratitude for how you made some choices today about how to move your body. And then also grounding yourself back in your space. So looking back around your room, maybe noticing a different color. And again, maybe making a list, maybe 2 or 3 objects that are the same color. So now I'm noticing green. You might notice a different color in your space. So as a way to kind of bring yourself back to the room, I'm going to come back to the slides to kind of close today. But you might notice something, you might not. This is kind of a practice that you explore and get used to. I know I kind of thought it was a little bit slow when I first started practicing, but I think movement and breath and being present with yourself can be really healing overall. So thank you for letting me share. I think the last slide is a little bit of information about my organization, Fenthera. I do groups every week, usually Tuesdays and Fridays, but not on holiday weeks. So feel free to join one of those or check out Trauma Sensitive Yoga's website. They have tons of facilitators all over the world. Lots of people are practicing this kind of yoga. But yeah, happy to answer questions if you want to reach out as well. And overall, thank you for your time. I know it's a holiday week, and thank you, Stuart and the team, for hosting me and having me here. So much appreciated.
Awesome. Thank you very much. That was very good. Something new for everybody, right?
Yeah, hopefully.
Good change. In fact, a nurse who's on a few of our programs, I'll say a few like that, but she wrote, "This was the best movement. I felt so free. Listening to your voice was wonderful.
Thank you so much. Yeah,
Okay.
I find that
All right.
too when I'm hearing the voice. It's like just very soothing.
Great. So I have a lot of questions for you, and for anybody that's
Sure.
online right now, let's thank what's her name? Courtney. I'm joking. Let's thank Courtney for doing this presentation. All right,
Name.
and if you have any questions, please type them in. You already know where to go, so just type in your questions, and I'll get to your questions. But I'm going to start with my questions as well. And so I have a few things for you about trauma-sensitive yoga, and then about mindfulness and mind-body and yoga and etc. All right, let's go one by one here. All right, so the first,
Cool.
you spoke about TC, TY, or whatever it is, and the trauma-sensitive yoga.
Yeah.
And
Yeah.
tell us though, like what is the best benefit of using this? I mean, I know you spoke about a lot of different things, and you spoke very quickly about
Yeah.
a lot of different things. So if you could just slow it down a little
Yes.
bit and tell us what it is that you feel
Yes.
is the best benefit for this.
Yeah, I think the best benefit for this, I know it's called trauma sensitive yoga, but I think,
Right.
like I said, anxiety lives in your body. So I think it's just a really great practice to practice managing anxiety. I think it's phenomenal. So a great body-based thing that you can do.
Okay, thank you for that. Next, how does trauma-sensitive yoga differ from traditional yoga? You got freelance movements. Is that what you were speaking about? You get to choose basically what you want to do.
Yeah, it's like, and it's a right, it's based on research, so it's very scientific in the ways that you're not going to say move into downward dog, you're going to say lift your hips, press into your heel, kind of like a typical yoga class, but it's based on a very specific script that they use for research. That's the difference.
So with everybody using their own form of doing this, is that something that they should like make a list of what they're doing, or is it okay to make changes to it every day, or should they be doing something more
Mm.
controlled?
Yeah, that's a good question. I think a lot of times when I'll do classes, I will do the same exact flow every class. And so sometimes we'll add in new things, and it's really kind of right. It's about every moment. So you can make a different choice at any time, but kind of having the same, like having your body learn the same kind of patterns can be really useful too.
Okay, great. So my questions must have invoked some questions. We got people asking questions, all right? All right, so first one says, this presentation was awesome. I really enjoyed the chair yoga practice. Thank you. All right, so that wasn't a question, but we'll get on to the other questions. Next person writes, does moving your head below your heart help with trauma-sensitive issues?
Hmm. Moving your head below your heart. I hadn't heard that. I'm sure, yeah, I should look into some research. I haven't heard it, but the body is amazing. The body is really amazing. So if it works for you, yeah, notice it.
Okay, and of course somebody writes, is this being recorded? Every one of our programs gets recorded. Okay, so yes, all of these get recorded and it'll go onto our YouTube channel in 4 to 6 weeks because we are that far behind because we do record every one of our programs. Okay, next person writes, lovely practice, more great resources. Accessiblyyoga.org and mindbodysolutions.org is what somebody else is writing. I don't know if you know about them. And another person, of course, says kudos for you, but we're not going to get to all these kudos yet because I've got other questions to ask. So going back with the techniques and the modifications used in trauma-sensitive yoga, is there anything more specific than anything else that should be done more regularly?
As far as the forms or the shapes that are being offered,
Yeah.
yeah, I think most facilitators will do the ones that I shared. So head and neck, arm movements, feet, legs, just I say simple, but just those just kind of level things are so profound. It's really amazing what that those simple movements can do. Shoulders, those kind of bases are good ones to cover.
Okay, good. And the next is person writes, should this only be done as chair, or is it okay to do from a standing position as well?
Yes, wonderful question. Totally. Stand up if you feel like you need to stand up. Yes. And then sit back down if you need to sit back down. Yeah, great question. Chair,
Okay,
mat,
good.
or standing.
All right. Another person writes, the past yoga classes were not recorded. Okay, due to the liability waiver. Yes, Dion, we know that, but this one is being recorded. That was the other person's practice. All right. She didn't have the same kind of insurance, maybe, or maybe that she was just in a different state. But yes, this program is being recorded. This is a one and only individual program, whereas the other one was just a yoga series that happened once a month. Okay, on to the next. Does trauma-sensitive yoga help with balance?
Does trauma-sensitive yoga help with balance? I think trauma-sensitive yoga will support you to be aware of how to balance. So yeah, I think if you keep practicing it, I know it's personally really helped me with balance. So yeah, I think it can for sure.
All right, so for those, though, that have the tingling sensation in the arms and the feet when they bend their neck too far, what do you do? Will that ever get resolved by doing all these different movements and et cetera? I mean, if I turn my head too much, I just get dizzy.
Yeah, that's a good question too. Yeah, and I think that's the part where I had the quote where it's like you might notice things that aren't as pleasant to notice, right? So it's not really about resolving it. It's kind of just being able to be more attuned to your body and notice, am I in pain? Do I need to move, right? You can move towards sensation, you can move away from it, but really it's not about resolving it. It's about building a better relationship with your body at the end of the day.
Okay, thank you. A person writes, well, a person writes, I got this for you. You spoke about non-coercive language, and can you give us some examples of non-coercive language versus coercive language?
These are awesome questions. I am so flattered that people
Thank you. I made it up myself.
Oh, wow. Look at you, Stuart. Well, an example that I would say is one example is, I guess I could say, like, Stuart, you need to like lift your arms. Like, Stuart, come here. Like, Stuart, I need you to do this, right? Versus like one option is you can do this, or if you'd like, possibly doing this, right? Possibly, perhaps, maybe if you'd like, kind of giving people choices, giving the people permission.
Okay, thank you. Before I ask you any other questions, for the few people that want to know what's wrong with my voice, I was diagnosed with acute bronchitis, whatever, just yesterday, and that was after a very difficult night of breathing 2 nights ago, all right? So that's what's wrong with my voice, nothing else. It'll come back in a week, all right? And you'll be back to my beautiful voice again. Thank you. All right. Next, what are, going back to the non-coercive language, how would you practice that in your daily life?
Yeah, good question. I think I got a text message from my husband today, and he's like, if you'd like to do this. And I was like, yeah. And he said, you can do this if it's useful to you. And I was like, oh, great, babe, great. Yes, you're using non-coercive language with me. Yeah, if it's useful to me, I will do it. So yeah, giving people choices. If it's useful, I use that word all the time. Is this useful?
So you say, all right, we're speaking in like harsh language here. What is coercive versus non-coercive? An actual meaning for it. Let people understand what we're talking about.
Yeah, coercive meaning like I have power over you and I'm making you do something. I'm not giving you an option. So do this now. Like a lot of parenting kind of coaching is like that, right? So sometimes when you have your family member, a child, whatever, you need to do this now. Come here, do this, do that, right? I'm not giving you options. Coercive is like having power over another person. Non-coercive is like, hey, these are your options. You can do one of them, you can do either of them. You don't have to do either. It's up to you to decide. So giving people their power, not coercing them, forcing them to do something.
Right. So then therefore,
yeah.
So you're talking about the non-coercive yoga. So therefore you're just not following the normal strategies of actual yoga. because you're just doing whatever you want to do just to make your arms flimsy and loosen yourself up, basically.
Sure. Yeah, you could do that. Yeah.
Okay.
And it's really about empowerment.
Okay, gotcha. And a person writes, so what's the difference between TSY, and somatic movement?
Yeah, good point. I think a lot of somatic experiencing, I'm not a somatic experiencing practitioner if that's what you're talking about, but somatic experiencing is like a similar movements, but TSY is just the ones that I'm trained in. So they can be overlapping movements, right? There's only so many ways your body can move, but these are the guided ways that TSY uses. And
So
I'm sure other practices will use.
So without sounding harsh, how does this make it sound like it's actually, why would you call it yoga?
Why would you? Well, because you can do yoga with this. It kind of starts in a chair, but I've yoga classes. Like I was trained with a lot of yoga teachers. So you can do this like forward fold. You can do downward, but you would do it in a way where you're not saying downward dog. You're saying lift your hips and press into your toes. And so you can do a full mat yoga practice with this kind of language that you're using, right? That you're saying, if you'd like to do this, you might do this. And so kind of offering those choices in a typical kind of yoga class.
Okay. Have there been any scientific studies for this using TSY versus actual yoga? The yoga that people know?
I don't believe so. No, but it's based in Hatha yoga is the type of yoga that TSY utilizes. Hatha yoga.
All right. So what is something that somebody needs to be mindful of to make sure that they don't hurt themselves doing all these freelance movements on their own without being guided?
Right. Well, they are guided, right? I'm facilitating and I'm giving people choices, but you'd be surprised. A lot of times people aren't going to take those choices. If people say lift your hands, people are going to lift their hands. And I think the most important thing about the practice is that you're encouraged to notice your body. So your experience might be different than mine, and you're encouraged to notice it, right? So if there are injuries, like being aware of that, I've had people talk to their PT, talk to different therapists that they work with, just around the medical piece about it. But it really is an awareness and attunement piece, so that if you are aware and attuned to your body, then you're not going to be moving in ways that could be harmful to your body.
Okay, thank you. And a person writes, by the way, I'm being the bad guy. There are the good guys that are out there, all right? People are defending you, but I'm not trying to be the bad guy. I'm just trying to bring out the other side of things, all right? All right, so a person is writing,
please.
The choice of movement is freeing. I feel like that was what you taught me today. So that's why I said that. All right, so going back to something else, are there any we spoke about the potential risks. So what I was talking about was, so you're telling people about what they can do right now, and somebody, when we get off this program tonight, might just start moving their shoulders and moving their arms. And I don't know, somebody like me who's very stiff and whatever, I might just yank out my shoulder while I'm doing this. But what would you tell them? I mean, should they start in a soft manner? Should they be as gentle as they can when they first started this? Should they try to be as rigorous as possible?
Yeah, good question. I guess guided. Make sure that you are guided by a trained facilitator when you're doing this. So you can do your stretching on your own, sure, but if you're doing trauma sensitive yoga, if that's your goal to connect with your body, be in a supportive environment. Have a professional that's doing it with you. You deserve that.
Right. Okay. Next, we have let's go to mindfulness. How do you incorporate mindfulness into your daily life?
Yeah, how do you not incorporate? Yeah, you can incorporate mindfulness. I can be mindful of Stuart's blue shirt, right? I could have used that as a color.
That's good. It's a good color.
Yeah,
though.
Noticing is huge. Noticing is huge, right? Noticing color is huge. Noticing sounds is huge. Noticing like textures that are satisfying is huge. Noticing thoughts. I do work with a lot of clients about noticing thoughts. That's a mindfulness practice. You can practice mindfulness right now.
Okay, good. All right. A person writes, I don't know where this is going to fit in, but it's somewhere in between right now. The ability to hear/feel my body helped me become aware of where I was sore and where I felt grounded. Thank you. Another person writes, would you encourage a person living with MS to practice on their own, or should this be in a class which is guided?
Yeah, totally guided. Or you can meet with a facilitator one-on-one even. The Trauma Sensitive Yoga website has tons of facilitators that you can meet with.
You know, it's really nice. Usually when I do these programs with doctors and whatever, they say a lot. With every question, they're like on and on and on and on, and I can't get them to shorten it up. But with you, it's great. I'm actually wanting you to go more, you know, give more of an answer than something short and sweet. All right. Are there any specific, going back to mindfulness, are there specific techniques that people should be using?
For mindfulness, I think sensory regulation is huge. If there's any OTs out there, they'll be like, yeah, sensory, occupational therapy. So being aware of your five senses. So things that are nice to look at, things that are nice to feel, right? The clothing that you like to wear is a great way to like practice mindfulness. Like what do you find comfortable? Foods, smells, all of that can be, right? Increasing positive experiences will support mental health. You know, you can have a lot of pain and feel joy at the same time. So being able to create positive experiences with sensory tools is huge. I'd say that'd be a nice place to start with mindfulness.
Great, thank you. Hey, you know, we're getting a lot of these questions, but it's all from the same 5 people. How about the rest of you? There's a bunch of you online here, and you know who I'm talking about. You know that you're not asking questions, so if you have anything to ask or say, please type it in, all right? And otherwise, we're going to go back to some of my stuff. All right, how do you get people to live in the moment?
Oh, yeah. How do we get people to live in the moment?
Listen
well, I think when you're laughing, you're in the moment. Yeah, listen to the sounds. Yeah, I know. Living in the moment's really hard.
Great song, Living in the Moment. So.
You might have to karaoke that one, Stuart.
No, I'm not going to karaoke it. That's for sure. Not with this voice, all right? But I'll send you the link. How's that? I'll send you the link. And that takes us to another person now asking, can music and scent burning candles be incorporated? Not around me.
Yeah, some people will do candles, music, TCTSY, the research, no candles, no music, trying to decrease the amount of variables as possible. With the research, they didn't do that. But if it's satisfying and useful, yeah, I think it could be really effective for some people.
So you just said research. So there is research being done on this then?
Yes. Yeah, there's a ton of research on it. They've had clinical trials on it.
Tell us about some of it.
Yeah, well, I had a slide that had some research against different types of therapies, but I know that they've done research with Prozac, with TCTSY, with different medications. There's a lot of research on TCTSY. So The Body Keeps Score, I know that's a bestseller, but Bessel van der Kolk, the yoga that he talks about in that book is this yoga. That's the yoga that he talks about.
Great. So tell me about people with a lot of spasticity and how this can be beneficial to their bodies to help them loosen themselves up.
Yeah, good question. I always say that it's like a yoga practice meets a guided meditation. So like the guided part, right? That's the facilitation, spasticity, numbness, right? Pins and needles, whatever symptom you're having. I think being able to connect with your body, and I think creating opportunities for you to do that. So I hear a lot of people say like, oh yeah, I do yoga all the time, but you know, when I'm in a class, it's a little bit different because even if it's online, you're with other people. You kind of have that accountability to actually do these things. I think there's plenty of things that Stuart and I know that are good for us that maybe we don't do, right? That anybody should do. But I think having a space, going to therapy or going to a yoga class or going to something creates the opportunity to do it because it is helpful. It's helpful to move your body. Your body wants to move.
Thank you. Are there any like resources out there other than listening to this program that people can go to learn more about the trauma-sensitive yoga?
Yes, I believe it's traumasensitiveyoga.com, but if you type TCTSY into Google, it'll take you there. Dave Emerson was one of the co-founders of this type of yoga, and you'll listen to his voice and you'll be like, wow, okay. yes, this is just so soothing. So if you type in Dave Emerson to YouTube, you can find out more about it as well. He has a book
Right.
about his research and his experience.
How do patients get their doctors to look at this, or to accept, not even to accept, but how do they even get the doctors to talk more about this? I've never had a doctor speak to me about this. I never heard of this type of yoga. I'm not a yogi, but I never heard of this yoga prior to
Not yet, Stuart.
connecting with you, back in September. And so when I looked it up, I mean, when I first heard it, I was like, what the heck is she talking about? I didn't say that word. I said a worse word.
Right.
But,
Yeah.
yeah, exactly. All right. So
Yeah. Yeah. It's a good point though. Just like about, I think, how do you get doctors to talk about mental health too? It's like a great point in general.
right.
So, sometimes we're not as like on the same page, clinicians and physicians. So just talking about depression, anxiety, trauma, any of that, I think is really important to talk about with your physician, and to find a therapist, to find a group, to be an advocate for yourself and talk about it. Because again, I think everybody has mental health. So talking about mental health, but then I think the trauma sensitive yoga piece, yeah, I mean, I think for a lot of people, like I think when I talked to you, Stuart, you were like, what is this yoga?
Yeah.
What is this thing that
Something
you
like
do?
that. Yeah, something like
It's
that.
like, yeah, it's
There were
fine.
there might have been
Right.
worse words than that, but yeah.
Right. Yeah. I think, yeah, it's a tough sell for some people, but if you think about it intuitively, of course, your body is going to have like your body carries everything. Your body carries everything. So
Sure.
anything that will be useful for you, I think, your physician probably
Sure.
would care about if it's going to help your treatment.
So a person writes where they can go where can you get training or certification on TCTSY?
Great question. They do I think it's a 9-month training for yoga teachers and for therapists. And I think like OTs, teachers as well. So definitely look into it if you're a nurse, if you're in the helping professions. I know they're always trying to expand who they can offer it to. But yeah, traumasensitiveyoga.com, TCTSY, they have a training program, a long one, and then they have shorter ones too. So definitely check it out.
Okay. One of our top 5 people of asking questions writes, would this be considered a mental health service provider, health insurance / provider for health insurance purposes?
Yeah,
Would
good
this be
question.
considered a
They talked a
mental
lot
health
about that.
service? Yeah.
Yeah, that's a good question. I guess it depends on your facilitator. So if your facilitator is a clinician, like if you're meeting with me and it's one-on-one, we can kind of figure out how to make this a billable service or to utilize your benefits, right? Because I'm a licensed clinician. So if we're doing it in a therapy setting, yes. If it's a class setting and it's at a yoga studio or even the classes I do, that's not billable to insurance because it's more of like a yoga kind of piece. But there's a lot of advocacy for this type of movement because there's research behind it. But if it's on a one-on-one setting and you're meeting with a therapist, I think it can definitely go through insurance, or it could be a billable service if that's what you're asking.
Before a person asks, I want to ask you, do you do this online?
Mm-hmm. Yes. Yeah. And a lot of people do it online. So I do it online. The groups I do are online every week. They're drop in. You don't have to come every week. But I know some people do them in like 4 or 8 blocks as well.
Right. So before I ask any more questions, how do people find you online?
Great. Yes. Panthera.com.
Yeah, it was a great question, wasn't it?
Yeah, look at you. Just like setting me up, taking the shot. Panthera.com. FANNTHERA.
Right. Not van, but a fan with 2 N's.
Yes.
Okay.
Or
Next.
not ban, but
Yeah,
fan.
not ban,
yes.
fan. It's not any of those, but you all will find it
yes.
when we publish this video. It's on her last slide, if you recall. She's got it all there. All right, you go to her website and you can find it. All right, next, let's go back to mind-body treatment. I don't remember if I asked this already or not, but what are the benefits of mind-body treatment?
I guess really 2 birds with 1 stone, right? You're doing both. And I think a lot of people get caught up in the cognitive thinking. I'm thinking all the time. What is it like to be present? What is it like to be in your body? art is great for that too. If meditation and yoga aren't accessible, art is a great way to do mind and body at the same time because, yeah, you're treating both symptoms.
So therefore, then, how does meditation help with the mind-body connection?
Then how does meditation help? Yeah, well, you're practicing having your nervous system relax, like being in rest and digest. Like your nervous system is learning, I'm safe. I don't need to be in fight, flight, freeze. Like I can release tension. And for so many of us, that is incredible, right? You can cognitively say, yes, I'm relaxed, but your body won't always listen because your body will remember what it feels like to be stressed.
How do you get your body to a point where you can feel the blood flowing in and out of your heart or through your veins, or the coolness that I've heard people talk about and feel? How do you do that?
Is this your question, Stuart?
It is. Most of them are.
I'm like, I know, sorry. I'm like, I don't know. That sounds cool. I don't know how you would do that. But I think breath is huge. I think being able to feel your breath, breathing, really allowing yourself to extend your stomach too. I think there's a lot of body, body dysmorphia or body shame or like just a lot of like hate towards our bodies with yoga or with any breathing body practice. But allowing yourself to breathe, breathing. Again, if it's not accessible to just breathe, I think doing art and breathing is really, really a cool way to practice mindfulness, reading, anything like that. But yeah, noticing your breath, good place
So
to
I
start.
brought all that up because many, many years ago, first off, I've lived in pain most of my life. And many years ago, I met with I don't remember what kind of practice she was. It was a long time ago. Anyway, she taught me how to get within myself, that I could actually,
Hmm.
after about a half hour, I could actually feel my pulse. I mean, I could actually
Hmm.
sense the blood running through my arms and into my heart and swishing
Hmm.
around and basically and coming back out again. And it wasn't just a matter of feeling it, but actually, it wasn't just a matter of feeling the coolness of it, but it was also that you could actually imagining you're in like
Hmm.
a voyage inside your own body, all right? And you can sit
Yeah.
in your capillaries and feel your blood going into your artery and going through your body and into your
Yeah.
heart and back out again. And you get yourself so relaxed that you could take the pain wherever you had it in your body and you can move it somewhere else. Okay. And once you were able to
Yeah.
do that, you had it. Okay, and
Yeah.
that was
That
taught to me by,
sounds amazing.
yeah, that was pretty good, and that was a way to help me get rid of the pain in my body. So and
Yeah.
no
And it's like a
everybody I was
guided imagery.
and no everybody was not doing drugs at the time. All right, at that time. Right.
Yeah. I think you have
All
to
right.
write a poem though, Stuart. The
Yeah. Thank you. I think I
voyage.
already did
I
that.
want to see
I
images
might
of
have
it.
already done that.
Yeah.
All right. So a person writes, I think when you're in tune with your body, you are able to recognize the change. You could be in a place of wonder without any judgment. Very true.
Yeah.
Very true. All right.
Wonder, curiosity. Nice word.
So do we have any other questions? Because I ran out. Oh my gosh. My chat GPT ran out of questions. Nobody have any question? Oh, here we go. Oh, you're going to know this person, so I could say his name. This is Omar with Fantera. Courtney shared a code on the last slide of her presentation for a free online group session to the MS Views and News community. Thank you, Omar. I think that
Thank you,
Courtney
Omar.
forgot about it.
Gosh.
But yeah, gosh. So you know what? When tomorrow, I'll try to bring that back up, and I'll send it out to all of you that were online here today. All right, and therefore that you have that before we have to wait for this to be published, because again, this could be 4 to 6 weeks before I actually get this published. Okay. And another person writes, excellent presentation. Thank you so much. We greatly appreciate this.
Thank
And yes, I hope to be able to have Courtney back online again one day. And we're all going to have to ask many questions. All right. Thank you. Have a great night. Bye-bye.
you.